Hello and welcome to the Headache Doctor podcast. Where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. I'm really excited because on this podcast, we have Dr. Omid. He is an ENT practicing out in San Diego, and he reached out to me and because we have a similar mindset when it comes to understanding and treating headaches and migraines, and just trying to solve this sort of what seems like this unsolvable mystery that's being masked with medication. So we're going to dive into some of the ins and outs of, well, really a lot of his story and how he got to be where he is, and his frustrations in the healthcare setting as it relates to headaches and migraines, and what he's trying to do to help that population. So I think you, the listener, will be enriched by this conversation. Dr. Omid, thanks for being on the podcast.
Hey, what's up? Thank you so much for having me. You're awesome.
Yeah. So, Dr. Omid, why don't you start out with just giving us your story, like, where, how you got interested in medicine and your journey through medicine, and then how becoming an ENT and then being interested in this headache and migraine space.
Yeah, for sure. Well, I was always into medicine. I think it was the only thing I was good at was like the sciences and stuff. I was always terrible at math and reading. So somehow I stumbled into medicine and just became obsessed with ENT stuff. I loved loved the ear surgeries, loved all the microscopic surgeries, the endoscopes and everything like that. Everything we do is just fine detail. And my story really starts just like most migrainers. Mostly, I think I've been a lifelong migrainer. My family all have migraine. I've been struggling with it my entire life. And it wasn't until med school when I really discovered that, whoa, like, I don't need to be suffering from this stuff. There's this
Mm.
huge part of me that has just been killing me, and I didn't realize I needed to address it. And basically, I was in med school. I was kind of one of the forefronts in trying to advocate for migraine treatment as it relates to ENT conditions, anything related to dizziness, ear fullness, tinnitus, facial pain, atypical facial pain, all those things. And about 10 years ago now, all this stuff was a bit new. I was thankful to be working under a mentor named Dr. Hamid Jalilian up in UC Irvine, and he turned me over to this stuff, and we just took off with it and published like crazy on this stuff. I wrote my thesis statement on it and just never looked back since.
That's amazing. I love that. So as far as in, like, what would you say was sort of unique or groundbreaking, or say, hey, here's something that's different as you entered into the space of head and facial pain?
Well, to me, it was almost like we had this huge population of people that come to us,
Mm-hmm.
and they come to you for help. Like, oh, you know what? My face is messed up. I just feel so much pain. And we would look at them and examine them, and all the metrics that we have as ENT doctors and ENT surgeons would completely be normal. Their ear
Mm.
exam would be normal, their facial, their endoscopy would be normal, their CT scan was normal, and then we would be like, I would watch all these doctors be like, all right, see you later. We don't have anything to do. Go see someone else. We don't know who it is. We go see someone else.
Right.
But then when you start learning about this migraine process where it's like, whoa, all we have to do is to treat the migraine, all your symptoms go away. I was like blown away. Like, why is no one else doing this? This is crazy. And we're just starting to learn about this stuff now from the ENT side, but just the ability to help others when most often they would just be turned away is like the best feeling ever.
Yeah, man, that is, I hear that story from my patients over and over again. The sense of going to see a specialist, someone who's trained for years. They should be they should understand this patient's problem, and yet they trial different, a series of treatments. It doesn't work, and then the neurologist ENT says, well, there's nothing wrong with you. You need to go, yeah, like you said, go somewhere else. We don't know where it is. So this is great. So you've entered in this space with a level of confidence. So when you say treat the migraine, what do you see as like the underlying problem, and what are you seeing be effective in your practice?
Well, here's the problem with migraine is that uh, American medicine is really good and really terrible at some things. We are so good, especially as ENT surgeons, we're so good at treating like a hole in the eardrum. You
Okay.
come and you see me, I look in their ear, there's a hole, I'm gonna do a surgery, I'll fix it, no problem. 10 minutes in, out. I do the surgery, everyone feels happy. It's awesome. When it comes to migraine, it falls in the cracks because migraine is complex. It's difficult to diagnose. It's not an easy fix, and it's not simple. There's no test that you can do to diagnose it.
Right.
It just requires a comprehensive care. So the way I approach it is, it's because it affects so many parts of your brain. You got to do everything that affects it. So always diet, lifestyle changes, the foods that we're eating, the stress, the sleep, all these things are so important. And for some people, starting medicines is helpful as well. It's
Hmm.
not my favorite part of my job, but definitely it's helpful and it gives relief to a lot of people. And so it's just a comprehensive care that requires in order to get any improvement.
Yeah, I love that. So you're saying when we're interacting with someone that has this heterofacial pain, we do all these objective tests, nothing comes back positive. Um, it's not as if we have to end there. Like we can look at their lifestyle, we can look at their general health and educate them on how to make improvements there, and then we see relief, we see benefits. Is that what you're saying?
Exactly. And the other problem with this is that with this approach that you're outlining right now, diet, lifestyle, all that stuff, it's not an immediate effect, right?
Right.
It takes at least a couple weeks, most of the time up to 2 months for you to find any relief. And because American medicine is so geared towards, immediate relief, patients are also we're don't we're not used to that as well. Sometimes it requires some patience to start feeling better, and so that's also like a paradigm shift for patients as well. To be patient, you're gonna start to feel better. You just have to trust the process. It's not going to be immediate. And I'm sure is that something that you've experienced too, right, Dr. Taves?
Right. Yeah. I tell people we sell crock pots, not microwaves. Yeah. So
I love that.
it takes a ton of effort to go through a process, and we find people that are really motivated to improve their health. And so, yeah, if someone's looking to take a medication, meaning they want the easy way out, it's usually not going to work. And so, yeah, it takes effort, it takes time, and but I think the thing that is most impactful for the people that we interact with, and I'm sure you're seeing this as well, is like when you're communicating, you have such hope and like excitement around, hey, there's something we can do. And I think if you give people that hope, then the motivation's there. Because the symptoms, the headaches and migraines can be defeating, and it's debilitating. And so you just feel like I've seen all these doctors, I've tried these different things, and it just feels like nothing's really happening. And so having a provider like you that's excited and says, hey, let's try this, I'm sure people are motivated to go through your process.
Yeah, of course. Yeah, the treatment of migraine is really difficult. It takes so much patience, and it's not that easy. Uh, and so I like that philosophy and that it's not just an immediate thing. And actually, starting medicines is helpful for the short term, but most of the
Right.
time, most people come back feeling some temporary relief, and they're really excited, at least for the first couple of weeks. But oftentimes, it's not long lasting.
Yeah. Let's dive into that a little more. So when we talked last, you mentioned neurology, obviously being like one of the primary or the primary sort of specialty that's interacting with this population. And you mentioned them sort of missing the mark, or in general, neurologists not having as good of a product, or feeling frustrated and not being able to help. Flesh that out more, and then let's talk more about the role of medication and what you see medication doing with this patient population.
Yeah, well, in general, again, the problem with migraine is that it just slips through the cracks.
Yeah,
You
right,
know, and so neurology, this is in general, and this is historically, I think the paradigm has shifted. And I don't want to badmouth any specialty.
right.
There's Everyone's trying to do their best to treat this condition.
Yeah,
But in general, historically, neurologists are really good at treating migraine conditions, um, for the most part. And ENTs are really good at treating surgical conditions
Mm.
relating to the facial pain, ear pain, all these things. And so there's these two different islands, and oftentimes the neurologists don't really recognize the migraine relationship with these head and neck manifestations,
Mm.
and therefore they think there's a sort of an ENT responsibility to it. And the ENTs don't want to treat the migraine as well, whether or not they are cognizant of the migraine process or no. And so there's always this back and forth where the neurologist is like, no, this is an ENT problem. You need to go see an ENT surgeon. And the ENT is like, no, this is a neurology problem because it's a migraine process. And basically, no one really wants to treat the patient. And so the person gets stuck in the middle.
Ah, yeah.
Or sometimes even on the ENT side, patients get inappropriately operated on. I've seen so many patients who
Hmm.
come to me after having a sinus surgery, and eventually just actually made things a little bit worse. And so this is the crux of this problem. If it was easy, we wouldn't be here today talking about this, you know? And
Yeah.
so I think that paradigm has shifted a little bit, though.
Right. So if I understand you, you're saying the neurologist might be interacting with someone and think there's more of a head and neck facial component to this, whether it's like sinus pressure, ear, maybe jaw, something like that, maybe neck. And they say this is an ENT problem. Then the ENT says, well, this is more of like a maybe like the neurological system has a component to it that you need to see the neurologist for, and both can't really agree, so the patient's kind of caught in the middle.
Exactly. They just kept getting sent back and forth, because the ENT will examine and like, there's nothing wrong with your face, there's nothing wrong with your sinuses. And then the neurologist examining like, oh, your neurologic exam is normal too.
Yeah,
But maybe on the CT scan, there's a little ditzel in the maxillary sinus or something like that.
right, right.
And so there's like this passive aggressive situation where the ENT is annoyed with the neurologist and the neurologist is annoyed with the ENT.
Wow. Yeah, and then the patient's just caught up in all that.
Exactly, because
Um,
you have to think about it from the ENT standpoint, at least for our culture. Most of our training is spent in the operating room. We're so good at surgical intervention.
right.
I'm like, dude, if you come to me and you have a bunch of sinusitis and there's snot coming out of your nose, dude, I'm your man. I'll take you to the OR. We'll open everything up. It takes 2 seconds. It's super fun. But when you come to me and your exam is normal and there's nothing going on, your CT scan is fine, and to treat you to treat you for migraine, that's a half an hour, 1 hour session where we talk about what's going on, the diagnosis, what's been treating you, and then I start you on some medicine, maybe, maybe not. And that's a repeat appointment. Each appointment takes so much time versus someone who comes with a hole in the eardrum. That's a 5 minute appointment. Boom, you're in and out. And the same thing with neurology. It just such a weight on the healthcare system
Right.
in this crazy world that we live in as doctors. They demand so much. The appointments are 15 minutes and the follow-ups are so hard to get. It like takes weeks to come and see a specialist. That's why I'm so frustrated with this process, and that's why I'm here talking to you. That's why I'm trying to do other ways in order to see what I can to help people, because our conventional healthcare system, in my opinion, is not the best at fixing this.
Right. Yeah. That is fascinating. I love that insight. Um, and I love that you're putting words to it because the patients feel it. I think me being in my role as a physical therapist and treating headaches and migraines, like I see that as far as very few providers, like I would say that some providers that have a sense of like humility and I don't know everything and continue to ask the question why, usually I stumble upon and are on this podcast. There's some that don't necessarily have that mentality, but it's not as if any of them are not trying to be helpful. It's just they're caught up, like you said, they're caught up in a 15-minute appointment. They're used to the quick procedures that get the results, and this is just it's harder. It's harder to know what to do with it. I'm curious, what is like screening for the neck look like in your world, or if you understand what that looks like in neurology, or just it, in med school, what is like screening for the neck look like? I talk a lot about the neck. I want to get your perspective on that. If someone came in and you thought the neck was a component, what do you think you would do?
I love that you brought that up, and that's why I love growing out with you, because that's a part of my world that I don't necessarily haven't been paying so much attention to.
Yeah.
I've always had so many people come in with unilateral neck pain, and I myself suffer for like after spending hours under the microscope, having my neck like this. I just feel like my neck's on fire, and it just causes the migraine trigger. So I will say I'm extremely, that's why I love following all your stuff, is because I'm extremely humble in that world, is that I don't necessarily do the next screening or things like that.
Gotcha.
And so that's a part of my world that I need to further elaborate on and further learn from you from.
Yeah. As far as, do you think, that's different for other ENTs or neurologists? I mean, I would assume that's, um, like screening for the neck is either non-existent or pretty minimal. Is that correct?
Absolutely. Absolutely
Okay.
correct. Yeah, that's not anything that we're talking about in any of the papers or any of the meetings that we go to, at least in my world and my group of people who are really migraine oriented.
Yeah, but in your personal situation, and then in the patients you interact with, you're seeing a connection there.
Oh yeah, I think everyone knows there's a connection between the neck and
Okay.
and, and its relationship with migraine, but I think have people done anything about it, at least in my world, or done anything like you have and address it specifically? Not so much, and that's something we need to focus on for more, definitely more.
Yeah. Wow. Okay. I I I wasn't like I wasn't trying to pick on you there. I really wasn't.
No,
And I
no,
appreciate I appreciate your humility there. And I do think so. For example, in what we do, I'm a neck specialist, but I want to stay in my lane, and I want to restore function to the neck. When it comes to other specialties, I leave that to them. And so referring out, I think that's how our healthcare system works. And one of the problems is, in my opinion, is providers trying to do everything, and then you don't do anything well.
yeah,
But I think having this awareness, like you're pursuing this and saying, hey, there's something with the neck and I need to learn more of it. And that's why you reached out to me.
absolutely, yeah,
That's an amazing thing, because just having that conversation with patients and saying, hey, like, your neck really seems to be a problem. I don't know if I have the right tools. And I have this conversation with people all the time with different things. I don't necessarily have the right tools or the skill set to know what to look at or treat here, but we need to pursue this. I think that is enough for people. Like, someone in your role saying that is enough for them to be like, hey, that's a really good doctor. That's someone who's really caring for me. So in medical school, we kind of went through cases with in PT school, we went through musculoskeletal cases with the fourth year med students. And I was kind of shocked at how little they had on the musculoskeletal system. But I would assume, Dr. Mead, you can verify this, but just taking a still image, like an X-ray, CT, MRI of the neck would probably be like the standard if we are going to screen for the neck.
yeah. I'm not even sure, to be honest with you. I know so little about this, and I think, as you alluded to, I don't even remember a lecture in med school about MSK stuff.
Okay.
And I think, yeah, it's just, I, I think, I think it proves the point that like migraine treatment is literally we know nothing about.
Hmm.
It's like we have just skimmed the surface. It's like, might as well be Mars for us in medicine. Like, how is it possible that there's four different classes of medicines that we use to treat
Hmm.
migraine, and that there's all these different specialties that are involved in the treatment of migraine? There's so much overlap. How is it possible that we're even like it just goes to show that as scientists, as the medical community, as me, as you, like we really don't know what's going on with migraine. And so there's so much more to learn. There's so much more research we need to do. And so we need to do this stuff. We need to focus on the neck. We need to focus on these things that actually make a difference in people, because to be honest, everyone needs to be humble. We don't know why these things work, why these things don't work, and why some people get better, why some people don't get better.
Yeah. Yeah. That's amazing. I love that. And the number of people that are suffering with these debilitating symptoms. I mean, I tell people when they ask me what I do, I help people with headaches and migraines. It's either like they suffer with it, or like they're 1 degree
Definitely.
removed. There are just so many people with this problem. Um,
It's insane. It affects so many people. Like I can tell you all the pathophysiology of like hearing loss and all these issues going on with the cochlea, but no one's focusing on the root cause of all these things, and that's migraine. And I'm not sure why. I'm so frustrated. Like I'm yelling at the top of my lungs, and
yeah.
no one cares. I'm like, dude, this is affecting way more people than these other things that we're not really don't really say they affect a small portion of people.
Dr. Mead, if you could take a stab at giving a percentage or just give us a sense of how many people would come to you with the diagnosis of migraine and you find something objective that says this is it, if we treat it, it goes away. How often does that happen?
Well, I will say almost no one comes to me with a diagnosis of migraine.
Okay. Okay.
People come to me with unknown diagnosis or they think they
Uh,
need some sort of surgery. Uh, but as far as when I do find the person who does have migraine, there's actually nothing that I see on my physical examination that
okay.
is able to cinch the diagnosis, and that's the beauty of it. And we have tried for years in terms of doing some objective testing, some like at least in my world vestibular testing, and there's
Right.
nothing out there in literature that tells you that this is a characteristic signature of having migraine. And for me, at least in my practice, it's nearly 100% based on history and examination in terms of ruling out other dangerous neurological conditions.
Okay, so you're saying someone comes to you with migraine like symptoms, and it's almost like a diagnosis of exclusion. Like obviously, if you find something else, it's not migraine. If you don't find anything else, and they're having this like uh, tends to be one-sided, throbbing, debilitating pain with light and sound sensitivity, maybe nausea. That pattern without the objective, here's something we can use to explain it, would lead you to say this is a migraine.
Absolutely. I think,
Okay.
as you alluded to before, migraine is so prevalent. Even the studies we have, it indicates like the highest quality level we have is like it affects 20% of the population. But that's even a BS study as well, because what are they using to define migraine? It's so difficult to define. So we all think that the prevalence of migraine is much higher than we actually think it is. Now, that being said, so basically, if you just throw blindly at a dartboard, you're probably going to hit a migraine patient. You know, our job is to rule out dangerous neurological conditions, make sure there's nothing going on that does need some intervention or something like that. And then also the last thing I wanted to talk to you about is sometimes people do come to me, they don't have the typical manifestation of light sensitivity, all those things that you're talking about. And I'm a big believer in actually your family history is so important.
Hmm.
People come with a family history of migraine, and the penetrance of the migraine gene is so high that if you have a family member who have it, is most likely have passed it off to you. Things like motion sickness, these are characteristic things that happen to migraineurs. And so I just want make people to make sure that they're not forgetting about that stuff as well.
Yeah, absolutely. Maybe that's a good segue into what are some of the practical things. I love your social media. I want you to share that with people. But
For sure, thank you.
what are some of the practical things that you have seen really help people when they start to make these changes in their life?
Well, so the problem is by the time a patient comes to me, they're so beat up by the system, right? They've been
Yeah.
struggling for so long, and I'm sure you see that as well. And
Right.
the longer the migraine manifestations continue, there's more of that chemical spill that happens in your brain. The stronger the synaptic connections happen in the brain, and
Right.
it becomes a little bit more difficult to treat, unfortunately. Um, I think like as I've seen, we can attest to the fact that we get patients better with treatment. You've seen it, I've seen it. We've all seen those patients who've been suffering for years and decades with this condition, and all of a sudden they get better with treatment. That being said, the most helpful thing I can tell people is that do not lose hope.
Hmm.
and do not hate yourself. People come, they're so pissed off with their body, they're so pissed off with their brain, they're so stressed out. And that's a huge hurdle to overcome. When you have a lot of self-hate of yourself and so angry and feel like you're never going to get your life back, that's a big stressful hurdle that is really hard to overcome. But if there's some way that you can get reassurance by meeting with someone like you or meeting like someone like me, and just let yourself go and know that you can get better and just trust the process and forgive yourself. There was a period in your life where you didn't have these symptoms. So physiologically, your brain and your body are capable of being free from this condition.
Right.
All we need to do is just to go back. And as soon as people recognize this, a light switch turns on and they have that hope and they have that faith and they let go of the anxiety and stress. That's the first step we can take in order to get you back to where we need to be.
Yeah. Yeah. I love that. I love that reasoning of there was a period of time where your body didn't have this. So physiologically, yeah, we can get back there. And also, yeah, the sense of time. I mean, there's a sense of urgency to yeah to start making these changes so that that pain pattern doesn't just continue to ramp up. And that's essentially what you were saying before with how our brain and our nervous system responds to pain itself.
Exactly.
We don't
And
want to
just for
teach
the
it.
yeah, and the fact that there are these people out there who are seeking your help and who are coming to see you and who are logging onto your social media, these are awesome people. These people are the people that are fed up with it and they want more. And so I just want to say for those people who are even listening to this podcast who subscribe to Dr. Tavi's stuff, you are already on the right track. You have already taken that step. You are already killing it. And that's more than what unfortunately most people can say about themselves because they feel so debilitated about taking that first step. And so applaud to you for even listening to this or if you are hearing this.
Yeah, yeah, I love that. Okay, another question. I'm curious. I feel like listeners would probably be helped in understanding the context of the objective things that you're looking for. One of the things that people ask all the time, or maybe it's in the back of their mind, is like, um, what tests do I need to have to continue to rule things out? And so, what are the things that you're testing for that you're not seeing in connection to migraine? Does that make sense?
Absolutely. So I think what people are alluding to, honestly, most people come to me, they're afraid they have a brain tumor.
Right, right.
And so I think we have no excuse to miss that. And so what I will say is this, I've seen a lot of brain tumors, and I've operated on a lot of things called something called the vestibular schwannoma, which is a brain tumor that affects your one of your balance nerves inside your brain. And so I've seen a lot of that. And what I will say, people who come with migraine symptoms, this is the key component you have to understand. Migraine symptoms, they come and they go. They get worse and they get worse sometimes and they get better other times. When you have an intracranial tumor, these patients, they get worse and they continue to get worse and they continue to decline. They continue to have progressive facial pain that gets worse and worse. It doesn't fluctuate. You get continuing hearing loss and it
Mm,
doesn't fluctuate. And so these are alarming symptoms. And so that's one thing right off the bat you have to recognize for yourself is that tumors, cancers, they get worse and they continue to get worse. They don't fluctuate. It's not like a tumor gets small one day and big another day. So the objective testing is always going to be an MRI. An MRI scan will be able to rule out those tumors. We always do that just to rule out any other conditions because we have no excuse as healthcare practitioners to miss any of that stuff.
right.
But 99.9% of the time they always come back normal. But after that, there's you know, not much objective testing we have. We're working on something called CRGP levels and all this crazy molecular testing in order to diagnose it, but we're not there yet.
Right. Right. Okay. Yeah. So, man, that's good, and it lines up with what I've educated my listeners on. And I think the other end of that is so in our process, if well, one, just hearing someone's symptoms having them explain to me what they're going through. You know, as a provider that's working with this population, pretty quickly I can sniff out, okay, this sounds different. Um, but if you're experiencing like chiropractic, massage, physical therapy, art treatment, and you're getting any relief, there's no sense where a tumor or something underlying would be helped by that at all. Is that fair to say as well?
Absolutely. Yeah, I mean, when you're, and that's the crux, what you just said is the crux of the answer, is how do you diagnose migraine? Is to treat migraine. If you're getting better with migraine treatment, dude, you have migraine. You know, people who have tumors don't get better with migraine treatment.
Right. Right. Exactly. Yeah.
And that's kind of the best, that's the state of the art technology we're at right now, to be honest with you. There's no molecular testing. The state of the technology for diagnosis of migraine is the treatment of migraine, and that's diagnostic confirmation.
Yeah. And when you say the treatment of migraine, in like our current healthcare system, what does that mean? Can you flesh that out a little bit?
So yeah, that depends. You know, if you're in my clinic and we're in the standard healthcare system situation, the diagnosis of the treatment, the fastest way to get relief, at least temporary relief, is to start medicine. The problem is medicines is such a difficult process. There's, you know, on average, it takes two or three different medicines to get people better. There's so many doses that you have to go up and come down. And so the short answer is medicine. The long answer is the true and tried and test way to get better is the diet, lifestyle changes, making sure you're focusing on avoiding those triggers, and that's kind of the gold standard that gives you the durable results that we're looking for.
Okay. Yeah. So those things being helpful, again, I mean, obviously screening for the tumors, for the cancers is appropriate. Seeing a medical doctor, going through those channels, if that's at all a concern. But the fact that, and I think one of the things that can be sort of like calming and helpful in the treatment for patients is just reassuring them that like the chances are, you know, if you're saying 99.9% of the time, like we're not finding these things, if you're responding to the medication, if you're seeing the triggers, you're able to avoid it. Like those are the scenarios where like you have migraine and we don't need to worry about the underlying problem. Like in general, is that fair?
Yeah, for sure. I mean, migraine symptoms are scary. Like some people come in with temporary weakness of their arm and
Right.
numbness and tingling sensation. Like, I mean, that's
Feels
never,
feels
I've
like a
had weird
stroke.
stuff. I
Yeah.
know, it's crazy. Like, I've had weird stuff happen to me too. And I'm like, if I wasn't a doctor, I'd be like, dude, I need to go to the emergency room right now. And it's scary. And it's scary for everybody to experience this stuff. But when you can explain it, most of it away with migraine and give reassurance, like that's so awesome.
Yeah. Right. Right. Um, yeah. Reassurance with migraine, but then hope of here's some action steps to take and we can get out of this, which is that piece
Definitely.
that you and I are frustrated with of like, hey, that's not really happening, right? Because
Exactly.
right now migraine is like a black hole of you just need to live with this until you're in your late 50s, 60s,
Oh,
and then maybe it'll
I
go away.
know. I know.
Yeah, it's crazy. Great. Well, thank Dr. Mead. Any other thoughts? I want to give you space for anything else that's on your mind, and then I'll have you kind of introduce your platforms and how people can get a hold of you.
Yeah, for sure. I guess the only thing is just motivation, you know, don't be complacent. Don't be okay with living your life like this. You know, you have no idea how much migraine affects your life in terms of not being able to enjoy your friends and family, the concentration, you know, missing out on hobbies. And for anyone who's listening who's had some relief, don't stop there. Don't feel like you have to, just because you got 60% better or 90% better, that you're done, you're good. Keep pushing, get greedy. I want you to be greedy. Get 100% better. You can get better. You can rid yourself of this condition. It's possible. You have people like Dr. Tavies, you have people like me who basically dedicated our lives to focusing this stuff, and we care about this stuff. There's people out there that love you, that want you to get better. I know there's some people that have good intentions and don't necessarily aren't as helpful, but there is resources out there. There's a great community out there. Just get involved, listen to stuff like this, get greedy, get back to 100%. You can get free from these conditions, and just get motivated. You can do it. It's possible.
That's awesome. And how can people interact with you?
Yeah, my Instagram thing is migraine.mentor.
Okay.
That's where you can find me the most accessible. I'm always on there trying to post stuff. And if you guys have any questions, feel free to comment or shoot me a message or whatever it is, and love to interact with you guys.
Yeah, and I'm assuming if you're in California, what's the name of your practice? And
Yeah, I'm in this group called the ENT Associates of San Diego. If
okay,
you're ever around in San Diego, come by, say what's up, maybe get a drink and some tacos, and we'll go from there.
that's awesome. That's awesome. Well, thank you so much, Dr. Omid, for being on the podcast. This was fantastic. I know our listeners were enriched, and we wish you all the best in your practice and the future with helping these people with headaches and migraines. Thanks so much.
For sure. Thanks, Dr. Tavies, for everything that you do. Your content is amazing. You're the man. And look forward to hanging out some more in the future.
All right.